Good evening, everyone. My name is Angela DeRolf, and I'm your Perry County Health Commissioner working at the Perry County Health Department. I'm doing our second Facebook message because I wanted to share with you that the Perry County has declared that a local public health emergency exists in Perry County. Although I want to be very clear that at this time, Perry County has 0 confirmed COVID-19 cases. Again, 0 confirmed cases of COVID-19 in Perry County, but that I feel Perry County has been threatened by the COVID-19 virus, also known as coronavirus. This is a pandemic as determined by the World Health Organization, the U.S. Center for Disease Control, the Ohio Department of Health, and the Perry County Health Department. I feel that as your health commissioner, that based on the strong mitigation efforts taken by Governor DeWine, the Ohio Department of Health Director Amy Acton, and the work that we have done here locally at the Perry County Health Department, that it is time for this declaration. So I mentioned, some of the strong mitigation efforts that are going on across the state. And these are some of the things that you have already heard, like the social distancing, staying home when you are sick, implementing telework or e-learning options, the closing of schools. I know that's been a big one that we've all had to endure. The banning of large gatherings, traveling only when necessary, suspending visits at hospitals and nursing homes, monitoring those that are sick, moving of some of the polling locations, and so many more, such as imposing restrictions on travel by state employees and temporarily suspending visitations in prisons and state youth detention centers. Requirements for teacher-student ratios have been eased for daycare providers and schools. And then as of yesterday, the Governor DeWine and the Ohio Department of Health Director Amy Acton during the press conference announced some additional measures that were being taken. The casinos and racinos are closed. However, some of the horse races are continuing, and it's my understanding that you can view these online. The nursing home order. I want to share that there has been an exception made in the order for the end-of-life situations for family and clergy visitation. It's also virtually impossible to do social distancing in the daycares. The recommendations from doctors is to remove your child from daycare if you have the ability to do so. So let me be clear, the daycares are not closing at this time. The recommendation then is if you have the ability to remove a child from daycare, that you do so. The state has also put out enhanced guidelines for daycares, such as for sanitation and compartmentalizing of the children if possible. So basically that means if you can keep all the same groups of kids in one classroom without exposing them to various kids within the daycare, that's what you need to do. The state is now recommending that dentists and veterinarians postpone elective surgery in an effort to preserve PPE. As many of you know, there is a great shortage of the N95 masks, and so there may be more orders on Monday to help preserve the PPE. That's the PPE that the healthcare providers are using. Also, many hospitals have instituted visitor restrictions. Many hospitals have also started screening measures for their visitors, so I recommend you call ahead and talk to your hospital before you visit. Then today, as many of you may have heard on the press conference, and we will share all this information on our Facebook, Governor DeWine announced that the Ohio Department of Health has issued a director's orders that will close all Ohio bars and restaurants to in-house patrons effective at 9:00 p.m. today. Restaurants with takeout and delivery options will still be able to operate those services even as their dining rooms are temporarily closed. There are also a number of aggressive steps that the administration is taking to offer assistance to Ohio businesses and individuals impacted by these and other changes, all of which aim to really slow the spread of the coronavirus, which causes the COVID-19. And so please watch our website. We're going to post the full governor's orders to the our Facebook page. We're going to post this information on our Facebook page, and we're going to keep that up to date as we go forward. So once again, I want to remind all of you that if you want the most up-to-date information, guidance documents, checklists, whatnot, check coronavirus.ohio.gov. please go to the site, read over the documentations, and if you have questions, give us a call. Again, if you're in the general public and you have general questions about COVID-19, the Ohio Department of Health has set up this call line. The number is 1-833-4ASK-ODH. So it's 4ASK-ODH. It's open from 9 a.m. to 8 p.m. 7 days a week, and it's staffed by licensed nurses and infectious disease experts. So please, if you have questions, call them. They are updated daily with the most accurate, up-to-date information. And then again, as I mentioned, go to our Facebook page. As this evolves and things continue to change, we are going to keep our Facebook page up to date. So that's where you need to go for information that we are sharing. So what can you do to prepare or protect yourself? Follow these steps. If you are sick, stay at home. Avoid contact with people who are sick if possible. Get adequate sleep and eat well-balanced meals. Again, wash your hands with hot soapy water. That's one of the best things you can be doing. Cover your mouth with a tissue when you sneeze or cough, and then throw that tissue away and wash your hands again. Avoid touching your face, your eyes, your nose, your mouth. And I know this can be difficult, but you really need to work on doing that. Clean and disinfect high-touch surfaces often. Wash up those cell phones, disinfect the cell phones, your doorknobs, your faucets, things like that you don't always think about. Be sure if you are feeling ill to call ahead. Call and let your doctor know what symptoms you're facing, and then they will let you know how this should be addressed. And lastly, practice good hygiene habits. I also want to recommend that you seek out accurate information from credible sources. There's a lot of misinformation out there. So please go to ODH's website, use the call line, go to our Facebook page. We will keep you informed. Be kind during this time. Stay mindful of fear and anxiety that could lead to discrimination or stigma associated with COVID-19. And help those around you. Think of your neighbors who may be elderly, or think of that mom out there who's a nurse and needs someone to help them by watching their child. So just be kind. This is your chance to maybe help somebody out in your community. Again, I want to thank you for watching this Facebook post. I am going to continue to make posts and share videos as information begins to change. So again, I just want to reiterate that at this time, we do not have any cases of COVID-19 in Perry County. I feel that it's time that we address all of these mitigation efforts and really work on addressing how these hardships are affecting our community and trying to pull together the resources and brainstorm how we can better serve our community in their time of need. Thank you.